I'm Dr. Ali. Welcome back. For those of you who are joining us for the first time, please subscribe to continue being part of this healing community where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician, and my goal is to provide education and guidance to our patients, their families, and our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. Today, we will be talking about a very important issue and diagnosis called diabetes. We will talk about how we can functionally reverse diabetes. So let's start off by discussing what is diabetes. So, normally, when we eat food, our body turns that food into different components, like glucose. And this glucose is used by our body for providing us with energy. In order for this glucose to be utilized by the cells, we need a hormone called insulin. This hormone is made in pancreas, and the role of this hormone is to allow the glucose to enter the cells so the glucose can be used by the cells for energy. In diabetes, there is a problem at the level of the pancreas whereby the pancreas, which is the organ that makes insulin, is not producing adequate insulin. The other problem that can happen is if the pancreas is able to produce enough insulin, but the cells are unable to receive that insulin or use that insulin, that can also result in what we call diabetes. The result of these two things is that there is a buildup of glucose in the bloodstream. This excess glucose leads to inflammation and then causes damage to organs such as eyes, kidneys, and heart. Now, what are the different types of diabetes? We're going to be talking about 4 different categories. The first category is prediabetes. Prediabetes is a condition in which a person's blood glucose levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. Prediabetes is a warning sign that a person is at risk of developing type 2 diabetes, as well as other complications associated with diabetes, such as heart attack and stroke. Type 1 diabetes is usually diagnosed in children and young adults, and it happens when the pancreas is not able to make adequate insulin. It can also happen after a person who is a type 2 diabetic, meaning has inadequate insulin, finally exhausts the pancreas and has no insulin. So it is possible for somebody with type 2 diabetes to become type 1 diabetic if they cannot make any insulin. Type 2 diabetes is the most common form of diabetes in adults. It can be prevented and even reversed with lifestyle changes, such as changing the diet plan, exercising regularly, and maintaining a healthy weight. Type 2 diabetes is a condition whereby the blood sugars are high, not because the pancreas is not releasing insulin, but because the cells of the body are not able to use insulin, resulting in the blood sugar going up since the glucose cannot enter the cells. Type 3 diabetes is a fascinating condition. It is a term which is used to describe a form of Alzheimer's disease that involves resistance to insulin, which means that these patients develop Alzheimer's because They have very high sugar either because they have deficiency of insulin or because the cells are not allowing the glucose to enter and they're resistant to the hormone insulin. So the theory is that insulin resistance in the brain leads to reduced ability of the cells of the brain to use glucose as energy source, leading to the development of Alzheimer's disease. So now, what are the risk factors for diabetes? There are a number of risk factors for diabetes. One of the most important ones is genetic. Genetics is involved in both type 1 and type 2 diabetes. If you have a family history of diabetes, you are going to be at risk. However, simply having genetic predisposition does not mean that you have diabetes, because we know that anytime you have a predisposition, it will only move from predisposition to actual disease if the genes are given the conditions that allow them to manifest the disease. The second important risk factor is age. We know that type 2 diabetes increases with age, particularly after the age of 45. Type 2 diabetes is more common in certain racial and ethnic groups, including African Americans, Hispanic and Latino communities, American Indians, and Asian Americans. Another important risk factor for diabetes is fatty liver. Fatty liver occurs when there is buildup of fat in the liver. It is commonly associated with obesity. Fatty liver leads to insulin resistance, which is the inability of cells to use glucose or allow glucose to enter, leading to high blood sugar in the bloodstream. Another very important risk factor is the food that we eat. So if we consume processed foods, sugar, and saturated fat, we increase the risk of developing type 2 diabetes. Presence of obesity is a very important risk factor for diabetes. Obesity is not simply related to what we eat or whether we exercise or not. There are many other reasons why people can develop obesity, which includes nutritional deficiencies as well as toxic exposures and infections. But the most important one is the microbiome, which is the gut bacteria in our digestive tract. Sedentary lifestyle is also a risk factor for diabetes. Diabetes and prediabetes are very common, and unfortunately, we find that the rate of diabetes and prediabetes continues to go up, with 1 in 3 individuals having prediabetes. Unfortunately, more than 8 in 10 do not know that they have it. 1 in 10 individuals have diabetes, and 1 in 5 of those do not really know about it, which means that the increased blood sugar is going to continue to cause complications, which could lead to blindness or kidney failure, stroke, heart attack, as well as wounds in their legs which do not heal, leading to possible amputations. In the earlier stages of the disease, there may be no symptoms. In the later stage of the disease, a person will experience more thirst and urination. There's going to be fatigue. There will also be blurry vision or distorted vision. Another important late sign is unexplained weight loss. as well as increased hunger because the cells are starving because they're unable to have the glucose that they need to make energy. So, what are the root causes of diabetes? One of the most important root causes of diabetes that we spoke about before is insulin resistance. The cells are becoming resistant to the hormone insulin, and hence the glucose is not able to penetrate the cells. The pancreas can be dysfunctional in certain individuals. This is the organ which makes insulin, as well as another hormone, glucagon, which are very important for regulation of blood sugar levels. The pancreas may not function if it has exposure to inflammation or free radicals, which is what we call oxidative stress, or even toxic exposures. A dysfunctional pancreas may not produce as much insulin as is needed for the body. Visceral obesity is basically abdominal obesity. It is the accumulation of fat around the waist and the abdomen, which is a critically important risk factor for type 2 diabetes and a root cause, because the fat in this area of the waist and abdomen is not dormant. Rather, it produces a lot of inflammation. It also produces hormones and chemicals which interfere with the body's ability to use insulin. Hence, the inflammation and oxidative stress produced by this fat leads to risk of diabetes and also other health conditions such as heart disease, stroke, and even autoimmune disease. Certain medications can also be the root cause of diabetes. These are called drug-induced diabetes or medication-induced diabetes. Examples of such medications include steroids, beta blockers used for high blood pressure, antipsychotics, statins used for high cholesterol, and certain immunosuppressants. Oxidative stress is another root cause of diabetes. This refers to an imbalance between the production of reactive oxygen species or free radicals and the body's ability to neutralize and eliminate them. When the number of free radicals being produced exceeds the body's ability, or what we call antioxidant defense system, then it leads to damage of the cells and inflammation, which leads to insulin resistance and increased risk of developing diabetes. In functional medicine, our goal for testing is to be able to address the problems, which means to assess the degree of inflammation, to assess the degree of oxidative stress, to assess the sources of inflammation, whether it be the gut microbiome or nutritional deficiencies or chronic infections, or for that matter, hormonal imbalances, which can also lead to insulin resistance. Once we find out the root cause, then our goal is to go ahead and address them. So the strategies that we use for reversing diabetes include lifestyle interventions, as we know that lifestyle plays an important role. What we mean by lifestyle is what we eat and put inside our body, what we expose ourselves to, whether through the use of certain products or the environment in which we are, such as if it's a moldy environment. It is also linked to how active we are. It's also linked to how we address our stress. All of that encompasses the lifestyle. Inflammation reduction is a key component because we know that chronic inflammation is the root cause of diabetes. The third thing we do is hormone balancing because we know that there are certain hormones, such as cortisol, which raise blood sugar and are implicated in diabetes. A very important factor which contributes to diabetes is the microbiome. Microbiome refers to the bacteria, viruses, fungi, and other living organisms that are present inside our digestive tract. And we need to be able to make sure that we have good bacteria inside a digestive tract and eliminate the bad bacteria or the bad fungus, which could be a very important source of inflammation. Another important factor that we work on is toxins because we know that certain toxins that we are exposed to on a day-to-day basis can lead to insulin resistance as well as inflammation and oxidative stress. In addition, we also want to make sure that we look at toxins such as mold toxins or toxins that are released by bacteria in the gut, because all of them could lead to the development of diabetes. And so it's important to minimize exposure to these toxins, such as use of natural cleaning products and avoiding certain types of plastics and pesticides. But it's equally important to detoxify the individual. Chronic infections, such as mold infections, such as chronic infections of the mouth or the chronic infections of the digestive tract, are also very important risk factors because they cause chronic inflammation and chronic stress on the body's immune system. And so finding them and addressing them is extremely important in order to reverse the diabetes and improve the insulin resistance. Thank you for being with us, and we hope that you subscribe and share this with your family members and your community so we can work together to understand how we can change the small things in life to live better and longer.